start looking for awareness initiatives. And in these regards, I think that Indonesian Continence Society is important among other societies in order to bring these initiatives for the physicians in terms of continuous medical education and for the lay public as well, because the overall awareness on the prevalence of such urinary tract diseases is very low.
Assalamualaikum warahmatullahi wabarakatuh. Selamat malam. Selamat bergabung kembali dengan saya Harrina Rahardjo di Instagram Live Perkina, Perkumpulan Kontinensia Indonesia, episode 5. Malam ini saya akan kedatangan tamu spesial dari jauh ini, dari Brasil, yaitu Profesor Marcio Augusto Averbeck, MD PhD, seorang spesialis urologi dari Moinhos Vento Hospital, Porto, Alegre, Brasil. Semoga saya mengucapkan dengan tepat ya. Beliau berkecimpung di bidang functional urology, kemudian Neuro-Urology dan juga inkontinensia urin. Dan kami pertama kali bertemu beliau di pertemuan ilmiah tahunan Perkina di Jakarta pada tahun 2018. Beliau hadir bersama tim dari International Neuro-Urology Society bersama Profesor Madersbacher dan Profesor Hamid waktu itu. Kemudian beliau mengadakan workshop hands-on urodinamik bersama-sama kami dan juga menjadi pembicara di pertemuan ilmiahnya. Beliau juga aktif sebagai komite di International Continence Society dan juga di International Neuro-Urology Society. Tentunya nanti kita akan mendengar bagaimana peran beliau di dalam dua organisasi tersebut. Nah, dalam rangka ulang tahun Perkina yang ke-20 ini kami ingin mengundang beliau untuk mendengarkan perspektif beliau mengenai inkontinensia urin terutama di negara beliau yaitu Brasil. Then I was telling the audience, Prof, that you were in Jakarta in 2018 and you were with Professor Madersbacher and Professor Hamid. You gave lectures and also conducted a urodynamic workshop. So for your information that the Indonesian Continence Society is turning 20 years now. It was founded in the year 2000. So I want to ask you, Professor, in your opinion, in the last 20 years, do you think a lot has changed in the incontinence, urinary incontinence management? Can you explain a bit about the situation in your country also?
Yes, of course. Firstly, Dr. Harrina, thank you for this kind invitation to be here with you. This is a good time to celebrate the Indonesian Continence Society Foundation. For me, it's a great honor to take part in this initiative, and it was a really good opportunity to take part in one of the annual congresses in 2018 in Jakarta. So, concerning your question, we can see that over the last 20-25 years there were significant improvements in technological advances in functional urology. And something we should consider is that when the new advances are firstly presented to the scientific committees and to the scientific community worldwide, it doesn't mean that the newer technologies, the newer medicines or treatments are promptly available in different countries. So I can tell you that when I came back from Austria after having been trained by Professor Helmut Madersbacher in European Association of Urology Scholarship Program, it was back in 2010. In my country, in Brazil, we didn't have like sacral neuromodulation approved for all health insurances. We had many problems to get approval of botulinum toxin for patients with both idiopathic or neurogenic detrusor overactivity. And just for instance, these points have changed since then. And nowadays, Actually, after 2014, sacral neuromodulation has been included in the coverage of all health insurances in the country, and it certainly represents something good for the patients who are suffering with chronic lower urinary tract dysfunctions refractory to conservative management. So I can tell you that for those patients with refractory OAB or chronic non-obstruction urinary retention, or even other patients with chronic pelvic pain or either fecal incontinence, sacral neuromodulation represents a good option for the treatment of symptoms in terms of for those patients who are refractory to conservative management. On the other hand, botulinum toxin is also promptly available nowadays in the country. It's very good. Since 2016, we have also approved and available in the market the beta-3 agonist Averbeck. And I believe that all of these advances come to the clinical practice to help us improve the line of care for these patients suffering with idiopathic or neurogenic OAB and other refractory lower urinary tract dysfunctions.
Yeah. And then I also know that you are an active committee of the International Continence Society, and who's turning, I think it's turning 50 years this year, if I'm not mistaken. And you are also active as a committee in the International Neuro-Urology Society. Can you share with us your experience in working with this established organization?
Yes, of course. The International Continence Society, the ICS, is a worldwide recognized association that is improving the line of care for those patients with incontinence, not only urinary incontinence but also fecal incontinence as well. So, firstly, I had the chance to become a member, international member of the ICS many years before. And then in 2012, I've submitted an application to become a member of the Neuro-Urology Promotion Committee. Fortunately, my application has been approved, and I was attending the Congress, the annual ICS meeting in Beijing, China, when I started working with this important committee of the ICS. And since then, I had a chance to develop some research initiatives. For instance, we had like a very important systematic review on the treatment of LUTS in patients with cognitive disorders and dementia, which has been published on the Neuro-Urology and Neurodynamics journal, which is the official scientific journal of the ICS. Among other, not only of the ICS, but also SUFU and other societies. And these research initiatives are aimed to improve the care of patients with neurological diseases who present with neurogenic lower urinary tract dysfunction. So dementia is an example of such disease, neurological disease, impacting the lower urinary tract function. But we have several other diseases such as multiple sclerosis, Parkinson's disease, spinal cord lesions, among others, that are relevant in the urological practice, and we should all be aware of the best treatment for each patient, because our international guidelines suppose that we should provide individualized treatment for these patients. Nowadays, concerning my participation in the ICS, I'm a member of the ICS Standardization Steering Committee as of 2019, and I'm now developing some works regarding standardization and terminology. So I guess this is something that is not so much appealing for the general physician, but it's quite important in terms of research in order to increase the level of evidence for certain treatments. We should be speaking the same language. In order to speak the same language, we must have some terminology standards, and the ICS is working very firmly, very close to the urologists, gynecologists, and other healthcare providers such as physiotherapists and nurses to develop such terminology documents to improve the level of evidence for individualized treatment of these patients suffering with urinary incontinence.
Yeah, I think it's really important that you have a standardization of the terminology because we can then speak the same language. And how about in Brazil, Prof? Are you also actively involved in the Brazilian Incontinence Society? And how is it embedded in other organizations such as Brazilian Urological Society?
This is a very interesting question. Thank you, Dr. Harrina. And I can tell you that in Brazil we have a different context because the Brazilian Urological Society, the TiSBU, is like the main urological society in the country. And actually we don't have formally a Brazilian continence foundation or society. Everything which is related to functional urology is under the umbrella of the Brazilian Urological Society. So I had a chance to work by the SBU in different committees and departments. So in 2012, I was the head of the Neuro-Urology department, and then back in 2014, I started working with the male urology department as the head as well. I had the chance to develop the online educational, continuing educational activities since then. And nowadays, I'm a member of the International Relationships Committee of the SBU. So the SBU is a very important urological association, and we have several initiatives being on hold and active nowadays, and among them the functional urology is represented by the departments, the Neuro-Urological department, the female urological department, and also the male LUTS BPH department. So these three departments are working together in order to develop and foster initiatives to provide better increasing awareness of functional urology, both for physicians and for the lay public.
Okay. And can you share your experience, Professor? In Brazil, do you still face a difficulty in the management of urinary incontinence? For example, in Indonesia, some of the devices for anti-incontinence surgery and pharmacological treatment are not yet covered by the national health insurance. So what is the situation in Brazil?
So this is a very important aspect of the treatment. Sometimes when we have different treatment modalities, in order for us to apply them accordingly, we should have these approved by the health insurances. So sometimes the treatments are so costly that for the individual patients that are not covered by health insurance, they are not feasible because it's too expensive. And as physicians, we should always think about what is possible for the patient, because when we prescribe the treatment, being like a conservative management, medication, or even a minimally invasive surgical procedure, if the patient is not covered by insurance, or even if the patient is covered by the insurance, is not obliged to provide such treatment, it's not feasible in the clinical practice to have all these modalities being used actually. So as I told you before, we had several advances in my country, in Brazil, So nowadays we have sacral neuromodulation, we have botulinum toxin covered by the private health insurances, but we have faced many problems because for the public health system we don't have specific coding to ask for sacral neuromodulation or either botulinum toxin. And we have some details that we should take into account for our country. Our system here is an out-of-the-pocket for medicine. So most medicines that the physicians prescribe to the patients, both for the insured and for the public health care patients, are not covered by the system. So the patient is supposed to go to a drugstore and buy the medicine by themselves. So this is a certainly limitation. We have several medicines that are available freely for the patients, but they are mostly for other chronic diseases such hypertension, diabetes, asthma, among others. But specifically in terms of alpha blockers, 5 alpha reductase inhibitors, 5 PDA inhibitors, antimuscarinics, beta-3 agonists. We don't have all these medicines being distributed, freely available for the patients that rely on the public health system. This I regard this as a limitation, but I understand that it would be quite difficult for a public health system to provide all the medicines that would be important for the population, so that the government is tackling the most prevalent diseases in terms of impact in the country. In this regards, conversely, we should increase awareness on the prevalence of urinary tract dysfunction, because according to several studies and data from the United States, for example, the prevalence of overactive bladder symptoms may be even higher in comparison to other chronic diseases such as diabetes, hypertension, asthma, among others. So sometimes we are just describing some limitations that we have nowadays, but we should start looking for awareness initiatives. And in these regards, I think that the Indonesian Continence Society is important among other societies in order to bring these initiatives for the physicians in terms of continuous medical education, and for the lay public as well, because the overall awareness on the prevalence of such urinary tract diseases is very low. And we have plenty of work to develop in the near future. This is my feeling.
Yeah, I completely agree. You have a good point, Professor. So I'm going to take you back a few years when you were a urology resident in training. Did you always know that you are going to work in this field, the neuro-urology, functional urology? Because in Indonesia, this field is not really as popular as the stone surgery, the endoscopy, and the oncology, for example. So what brought you to this field? What brought you to this specific work that you do now?
This is, Dr. Harrina, a very good question. And I completely agree with you that, especially some years before, endourology, laparoscopic surgery, more recently robotic surgery, is the trendy trendy areas within urology, for example. But fortunately, due to the recent advances in the field, I can see that this trend is being changed a little. And fortunately, we have several residents that are now more and more interested in knowing more about urinary tract dysfunction, urodynamics, neuro-urology, functional urology as a whole. And I can tell you that when I was a resident, I always was very much curious about how the urinary tract was properly working in synergy. For example, how did the bladder work in synergy with the external sphincter? How could I interpret the urodynamic curves? How could I perform urodynamics according to the ICS standards?
Yeah.
And this curiosity led me to go for a proper training after finishing my residency in urology, as I told you before, as I received a grant, a scholarship from the European Association of Urology to become a clinical fellow with the Innsbruck University, being hosted by Professor Helmut Madersbacher in the Innsbruck Neuro-Urology unit. I guess that everybody knows all this research and clinical work which has been led by Professor Helmut Madersbacher, who is well-known worldwide.
Yeah.
And well, I feel myself fortunate to have been given the chance of being a clinical fellow with him in Innsbruck, and by learning so much with him. And I can tell you that it was a game changer in my medical career, and I can now develop my research initiatives focusing on urinary tract dysfunction, and I'm mostly dedicated to functional urology in my clinical practice. So I guess that more and more we'll see the residents being searching for functional urology education. And I'm very happy to share these insights with you, because this situation has changed a little over the last few years. And I guess that this trend comes together with the development of neuromedicines, neuro-minimally invasive treatments with neurotechnology. And can you imagine back in 2010 that, for example, we'll have in different countries sacral neuromodulation, tibial nerve stimulation, botulinum toxin, not only antimuscarinics but also beta-3 agonists, urodynamic technologies. Could you imagine that ambulatory urodynamic would be available in some countries? And all these technological and medical advances are somehow related to a great, better, higher interest in terms of functional urology training. These are my feelings.
Yeah. So, Professor, you have mentioned several of your hopes for the management of incontinence in the future, but can you conclude for us what is in store in the next 20 years for the functional urology and the urinary incontinence field?
Well, this is something difficult to say, but I'll talk about my own perspectives concerning some unmet needs that we still have in functional urology. I guess that we still need medications to treat detrusor underactivity. Nowadays, we don't have any drugs to be prescribed to these patients suffering of detrusor underactivity. And this is quite frustrating, because the prevalence of such disorders is not low in our clinics. So nowadays we are mostly focused on preventing bladder damage for those patients with neurological diseases, and also for those patients with chronic bladder outlet obstruction, such as patients with benign prostatic enlargements. But we don't have any medicines to treat detrusor underactivity, and it would be very nice if we had something like this in the future.
Yeah.
We know that electrical stimulation techniques, both non-invasive and invasive sacral neuromodulations, may be an option for some of these patients, but we still need further advances in this field. On the other hand, we are expecting newer trials to be published concerning stem cells.
Yes,
Prove
I was just going to ask you.
yes, to improve the function of the external urinary sphincter. Some patients may develop external sphincter underactivity as well. And we have a great expectation that the newer trials will bring further insights on the role of stem cells and injections within this area of the external sphincter to improve the contraction of this muscle group. I guess that these are very sensitive areas in which we have unmet needs in terms of functional urology, and I'm looking very much forward to having further evidences of newer studies or clinical evidence of efficacy concerning stem cell therapies.
Okay, so this is my last question, Prof. Do you have any take-home messages for residents who might be interested in this field, the neuro-urology and functional urology, or young urologists already set out to work in this branch of urology that might not be as popular as others, but I think from your answers that it can be promising.
Yes, of course, Dr. Harrina. I would have like several tips for the younger researchers and residents, and I'll start with something that made a difference for me back when I was a resident. Consider becoming a member, international junior member of international societies which may provide scholarship grants. So this is something that helped me a lot, even before graduating as a urologist. I was a member of the European Association of Urology, and as soon as after I finished my formal training in urology in Brazil, I submitted an application to become a fellow, and this application had been approved. So I feel really fortunate to being given the chance to become a clinical fellow of the EAU in Austria. I guess that sometimes the grants are available, but people don't know they are available at all. So please take a look at the web pages of the major urological societies, including the EAU and also the ICS, because there are available grants from time to time, and usually they are meant for international members. So please consider becoming a member of these international societies. I guess it's a very good idea. The second suggestion would be that, please try to be together with specialists who are performing urodynamics. Urodynamics is a very good examination to better understand how the lower urinary tract function, the normal function, is. So please pay some attention to the urodynamic practice, technique, and interpretation. I guess that it makes all the difference in terms of providing a better understanding of functional urology as a whole. Okay, these are my tips for the younger researchers and residents, and for those who are in Indonesia, why not becoming a member of the Indonesian Incontinence Association, as you've been leading so many initiatives concerning continuous medical education and research. I guess that I should at last congratulate you, Dr. Harrina, and all the colleagues from Indonesia to have been working so hard to increase awareness of functional urology and all the treatments for urinary incontinence in your country. So, great pleasure to be here to talk to you, to discuss some insights. And well, time passes by so quickly. I still remember when I was in Jakarta, and it was very pleasant environment for me. I had like the opportunity afterwards to be in Lombok, if you still remember.
All right. Yes.
Soon after the Congress we had in Jakarta, I had to travel to Lombok.
Then you went to Lombok, yeah?
Yes, and it was very good opportunity to know better about Indonesia. Unfortunately, we had like an earthquake, very severe earthquake. Fortunately, it was all good, but for me, as a Brazilian, because we don't have like earthquakes in Brazil, it was a little bit scary, but fortunately, all went well. And in the end, I still bring with me very good memories of the time I spent in Indonesia, and all of you that treat me so well and were very kind by receiving the international speakers in Jakarta back in 2018. Thank you very much for the invitation to be here.
Yeah, thank you very much, Professor, for accepting our invitation to be in this Instagram Live. And when you were a guest speaker in 2018, there was a very good workshop and lectures. And so I hope that we can see each other again in person when the situation of the pandemic is better. I haven't been to Brazil, but I know that it's the furthest I have to fly from Indonesia. How long did it take you to fly from Brazil to Jakarta?
Wow, it was almost the whole day, more than 24 hours, including all the connections. I know it's far away and we don't have direct flights usually from Brazil to Jakarta, but despite being a long travel, it's worth. And I was happy to be there with you in 2018, and I hope that we can see each other very soon again.
Okay, Professor. Once again, thank you very much for joining us. So this session will be recorded and then will be uploaded also at our YouTube channel, the Indonesian Continence Society channel, the Perkina channel, and don't forget to follow us on our Instagram, pp.perkina. Okay, Professor Averbeck, I will see you later. I hope soon, and then take care and stay safe. Okay.
Thank you very much, Dr. Harrina. Pleasure again to be here with you. Bye bye.
Okay. Bye bye. Have a nice day.